Hello, I'm Dr. Maes with Health Hub Clinic and Health Guardian Imaging, and I want to make a plea to all my family, my friends. I want to tell you why I started these two businesses. Too many people in our daily lives are finding out after the fact that they had a treatable illness or that they have a devastating cancer or something like that that could have been prevented or at least treated a lot easier. And so that's why I opened up the Health Hub Clinic and Health Guardian Imaging, because currently insurance does not cover any screening exams. And that's the tragedy with healthcare that we have right now, is people are just waiting to go to the doctor until they're sick. And we have to change that pattern, because people don't want to wait till you're sick. We want to get it done when it's still preventable, when it's still treatable. And the best way to do that is with screening. I have a close family member today that was just diagnosed with cancer, and it had already spread to her body. And I've been trying to get all of my family and all my friends to come in and see us here at the clinic. It's not about money to me. It's about getting patients taken care of when there's still something we can treat, when there's something we can do. I don't want to keep waiting till we're in the situation that we're in with my family member, where now the cancer's gone everywhere. And it's very hard to treat at this point. It may not even be treatable at this point. But there was a point in the course of that disease that it was treatable. And for her, she had been sick for 6 to 12 months and no imaging had been done. Her doctor either didn't pursue it further or didn't know the extent of the symptoms she was having. But nonetheless, she didn't get the treatment she needed. She didn't get screened. She didn't get the imaging she needed. She didn't get the lab she needed. And now we're at a point where there's no treatment option for her, likely. I hope as we investigate the cancer further, there will be a treatment, but I don't want this to happen to any more people. And that is why I opened up the clinic and the imaging center. And if you're one of my friends out there, you're one of my contacts out there, please send this to your friends. We have to take proactive control over our healthcare and stop waiting for people to get sick and then they die. That's just foolishness. We need to use the technology we have already in place. And if we have to pay for it ourselves, we pay for it ourselves. I will make sure it's affordable. I will make sure that my clinic is affordable for you to get the screening you need so we can prevent disease and not have to wait for people to get sick and die. Thank you. My name is Dr. Maes. I'm with Health Hub Clinic and Health Guardian Imaging. I'm going to have 2 more parts to this video where I'm going to go through the problems with health insurance and I'm going to provide the solution for it. Thank you very much. Hello, this is Dr. Maes with Health Hub Clinic and Health Guardian Imaging. I want to explain where our dollars are going for health insurance right now. We've all seen the price of health insurance go up dramatically over the last years. And even within our own company, every year it seems like it goes up 8 to 9%. And where is that money going? Because I can tell you as a physician, it's not going to the clinicians. We have not had an increase in our reimbursement rate from insurances in 10 to 15 years. So it's not going to the clinician and it's not going to patient care. So I'm going to show you where your increased costs are going. Right now, we have several things that are playing into this. Number one, the insurance companies are allowed legally to have a 20% profit. So that means for every dollar we pay for health insurance, 20% of it is going to your health insurance company directly to help with the profitability of their company. That's going to big bonuses for high-level people that are not providing healthcare at all. The second thing, 35% is going to administration. We've made our billing process in healthcare so complicated that we have to have a CPT code, we have to have prior authorization, we have to have an ICD-10 code to do anything. To submit that, it requires so much manpower to submit it, to get the prior authorization. We bill it, it gets rejected because there's a mistake. We have to rebill it again. We're wasting money. And that's accounting for 35% of our health insurance costs right now, 35%. So you can see right now, we are already 55% is going from every dollar you spend on healthcare to the insurance companies and the administration costs that are required by the insurance companies. Every bill that is sent out from a hospital or from an imaging center or a clinic has to have an ICD-10 code, has to have a CPT code. Why? Because our government has the bureaucracy and they want us to have that on every exam they bill to CMS. CMS is Medicare, Medicaid, and TRICARE. So we have to have that code on there. Same thing with the insurance companies. They won't pay the bill unless that code is on there. And God forbid you get that code wrong. Because if you put the wrong code in there, you're either going to get penalized or not paid. And so that's what's driving up our healthcare costs, guys. The last thing, hospitals. 20% increase in prices because the hospitals are using imaging and healthcare as a revenue generator. That's why you see these urgent cares popping up on every corner. I know in my town in Springfield, Missouri, there's an urgent care on every corner that's owned by the two competing hospitals. So they feel like they need to put an urgent care everywhere. Why? Do we need that many urgent cares? Because they're making so much profit at these hospitals that they can fund these new buildings that go up everywhere. Meanwhile, if you do the math here, 70%, 75% is going to things that have nothing to do with healthcare. The healthcare cost is getting 25% of the budget for insurance. So when you pay your insurance premium, 25% of that is going to take care of you. The rest is going to red tape. 75% of every dollar you spend on your healthcare costs is going to red tape. Administration, insurance profits, and hospitals driving the costs up. And I think it's important that we all understand that. So when you get that bill from your insurance for a deductible that you haven't met yet, this is where your money went. So you have an insurance policy that maybe has a $3,500 deductible and a $50 copay and 80% coinsurance. That means because your deductible is $3,500, the insurance company pays nothing until you've paid in $3,500. This means that even after the 80 means that even after you paid that $3,500, the insurance company still doesn't pay for it. They only pay for 80% of it. So they're still shortchanging us. The average American will never hit $3,500 deductible in a given year. I've hit my deductible one time in the last 15 years. So I'm spending $1,000, $2,000 a month for my family to be insured, and the only ones that are getting the money is the insurance company and the administration, which is run partially by the hospitals. So here we are, all the clinicians are fighting over this little 25% that's left over, and meanwhile, my health insurance doesn't even cover anything because my deductible is so high. This has to stop. The next video I'm going to show you is how we are going to stop that at Health Hub Clinic and Health Guardian Imaging. And I want to explain it to you exactly step by step so you understand where every dollar is going and you can understand how our plan works differently from traditional health insurance ripoffs. Thank you. This is Dr. Maes with Health Hub Clinic and Health Guardian Imaging. Hi, I'm Dr. Maes with Health Hub Clinic and Health Guardian Imaging, and I wanted to show you transparently our prices here at the clinic. The first video I sent to you guys is a plea. Please do some screening exams so we can prevent illness and we can prevent disease before it happens and it can't be treated. The second video I sent you is showing you exactly how health insurance companies are ripping us off right now. And the third one is I want to give you completely transparent prices on what we do here at Health Hub Clinic and how it works, how everything operates here. So we have 4 different pricing plans: the Essential, the Complete, the Premier, and the Plus. Okay, these are the prices above. So Essential is $25, Complete is $50, Premier is $79, and Plus is $190. And that's a per month cost. Okay, what this gets for you if you have a $25 membership, the Essential, you get clinic visits for $50. So all your clinic visits, anytime you come in, you will only be charged $50. Labs, we charge $75 for the first panel and then $50 for every panel after that. Medications are not included. Virtual visits are not included. The next plan we have is the complete, which is $50 a month. And for that one, you get $50 clinic visits, the same labs at $75 and $50 for the second panel. But now meds are included. So we have a formulary of 1,200 medications. It's the most comprehensive formulary you can get that will cover all the major disease categories. And so we can get you those medications, but it's included in your membership. You don't have to pay extra for these medications. We'll mail them to your house as long as it's one of those 1,200 medications in the formulary. And I can promise you, it will cover most disease processes. And so that's going to be covered for $50 a month. The $79 a month Premier Plan, clinic visits are included now. So you do not pay for clinic visits. You do not pay extra. $79 a month, you can come see us in clinic anytime you want. So if you want to come every week, that's fine. No extra charge. Labs are still going to be the $75 and $50. Medications are included. And now the virtual visits are also included. So you can come see a clinician in clinic anytime you want or virtually anytime you want for $79 a month. And also your medications are going to be included in that price. You can't beat that. There's no health insurance that's better than this. Okay, for the Plus plan, medications are included, clinic is included, and labs are included. So everything is included in the plan. So for $190 a month, you can come see a physician anytime you want. You can come see us in the clinic, or you can see us virtually for $190 a month. You have your medications included, and you have your labs included. So at $190 a month, you basically have no out-of-pocket costs. Now here's the special thing about the Plus membership. If you want to go see a specialist, it will cost you $50 to go see a specialist, but you can go anywhere you want. If you want to go to Mercy, you go to Mercy. If you want to go to Cox, you go to Cox. If you want to go to Mayo, you go to Mayo. Any hospital in the country is covered to see a specialist for $50. If with the Plus membership, $190 a month, and your membership will get you a specialist visit for $50. That includes urgent care. That includes any kind of specialist. If you want to see a chiropractor, it's $25. And if you want to see a counselor, $50. It's the best deal you can get. The beauty of it is you can go anywhere in this country, and within reason, you can go anywhere in the world and get the same care with a $50 copay. Your insurance currently does not offer that. You have to go to one hospital. So if you're like me, one year we're going to Cox, next year we switch, we're going to Mercy. You don't have to worry about that anymore. You can go to whichever one you choose. You can stay at your doctor. If you want to go to your specialist and they're at Cox and you have another specialist that's at Mercy, you can go see them both. If you have this $190 a month plan, and it'll be a $50 copay. That's it. Now, we have something really special, which we've just added, and that's our max coverage. And so for between $220 and $400, it's based on your age, they will cover you for catastrophic illness. And that's really all that traditional health insurance does. Because that $3,500 deductible is there, you don't really have any coverage unless you have something really bad happen to you. Unless you had a car accident and your bill is $25,000, then sure, your insurance is going to make you pay the first $3,500, and then after that, they'll pay 80% of the remaining balance. But what we have, you pay this amount, and you decide the maximum you want out of pocket. Most people decide to have $2,500 max out of pocket. And what that means is when you go to that ER because you're in a car accident, this is the most you're going to pay. You're not going to pay any more than that. You're fully covered after that $2,500 initial amount. And so that is a huge difference. By doing this, for $190 a month, plus between $220 and $400 a month, depending on your age, you will have complete coverage for outpatient care and inpatient care. You'll have catastrophic coverage. So you can see that if you put these numbers together, you're going to be somewhere between $400 and $600 completely out of, that's it. That covers all your healthcare needs. Your outpatient care, your inpatient care, your specialist care, your medications, your labs. Everything is covered. Now, the only thing that isn't covered with this is the imaging, and that's why we have Health Guardian Imaging. We're able to offer our imaging at a very discounted rate. Everybody that's a member gets a 10% discount off of our already reduced rates. We have the same equipment that you'll see in the hospital. We have a closed 1.5 Tesla magnet. We have a 128 slice CT scanner. We have an ultrasound machine. We have X-ray, and we have DEXA right here in Springfield, Missouri at Health Hub Clinic and Health Guardian Imaging. Our prices for imaging, $600 for an MRI. For a CT, it's $400. For an ultrasound, it's $160. For an X-ray, it's $100. You can't beat those prices. If you go to the hospital or urgent care for any of those things, a traditional MRI, $4,000. A traditional CT, $3,000 to $3,500. Your labs, if you go to the hospital and get your labs done, you're going to pay $600 to $1,000. And again, with our plans, the most you're paying is $75. But once you get to the Plus plan, your labs are included. So you're not paying for clinic visits, you're not paying for labs, you're not paying for your medications, you're not paying for the virtual visits. And if you want to include the catastrophic coverage like I talked about here, $220 to $400 based on your age. That can't be beat. This is a third to a half of the price of traditional health insurance. Now, we can't call it health insurance because we're not a health insurance company. What I'm calling this is health coverage. We have health coverage to take care of patients in our area and the surrounding areas. And these are the set prices, very transparent, and exactly what is included. And if you have any questions at all, give us a call. Health Hub Clinic and Health Guardian Imaging. So healthhubclinic.com or healthguardianimaging.com. Our phone number's on there. Give us a call, request a tour. We'd be glad to show you around and show you how we are changing medicine here in Springfield, Missouri. And we're going to make it more affordable for everyone. Thank you, guys. This is Dr. Maes with Health Hub Clinic and Health Guardian Imaging.